If your fingertip is hanging or drooping down and you can't lift it up again, even when you try, then it's possible you've got something called a mallet finger. Keep watching to find out everything you need to know about mallet finger injuries. How do they happen? What do you do about them? And do you need to get an X-ray? Welcome to this video from Flex Physiotherapy. Please keep in mind that we are only offering general advice and general information about mallet finger injuries. If you have a mallet finger injury, please get specific advice of how you should treat your injury from a local doctor or hand therapist. So what is a mallet finger injury? From the outside, looking at the finger, a mallet finger injury looks like a drooping or hanging fingertip, a bit like this. It can be pushed up into a straight position, but it can't be pulled up using your muscle power. The reason your fingertip is drooping in that position is that the extensor tendon over the top of the finger is no longer attached to the bone at the tip of your finger. Maybe this is an injury to the tendon itself, a soft tissue injury, or maybe it's a fracture, a piece of the bone has come off. Either way, the outside appearance is exactly the same. So, how do mallet finger injuries happen? Mallet finger injuries occur when this last joint, the end joint in the finger, gets forced into a bent position. That might happen if the fingertip gets hit by a ball. It might happen when you're tucking the sheet under a bed and the fingertip gets caught up in the sheet. I've even seen it happen when a patient was sliding a sock off their heel and the fingertip just rolled underneath. Any sudden impact or bending force to the fingertip may potentially cause a mallet finger injury. Mallet injuries are sometimes really obvious. They can be painful, traumatic, a sudden impact with swelling and bruising and pain in the fingertip. But some mallet injuries are very subtle. Patients often have no recollection of how the injury even happened. There's no pain, bruising or swelling, just a drooping, hanging fingertip. What about surgery for mallet finger injuries? When is that appropriate? Let's have a look at some examples of X-rays of patients with mallet finger injuries. Here's an X-ray of a patient with a mallet finger, but the bones in the X-ray look completely normal. There's no sign of a fracture at all. This patient must have a tendon rupture, a soft tissue injury. They should do very well with a period of splinting, allowing the tendon to heal. On the next X-ray, we can see the most common type of mallet fracture, a small avulsion fracture. A little piece of bone has been pulled off by the tendon. This is a very safe fracture. It has minimal effect on the joint, and it should also respond very well to treatment with splinting. In this final example, you can see on the X-ray how a very large fragment of bone has been pulled off by the tendon. So large, in fact, that the DIP joint has become unstable and has subluxed or slipped. This patient will almost certainly do better with surgery and is likely to have significant trouble if they're treated with only splinting. What about X-rays? If you have a mallet finger injury, should you get an X-ray? Studies have shown that about 45% of mallet finger injuries have some bone injury. The other 55%, the injury is all to the tendon, to the soft tissues. And from the outside, they look exactly the same. There are some important differences about how they should be treated. Most mallet finger injuries can be treated with splinting, just holding the finger straight until it heals. And that's true for most fractures and for soft tissue tendon injuries. But some of the severe fractures, splinting is not enough. So we recommend that all of our mallet finger injury patients get an X-ray so we know for sure, is it a fracture or is it a soft tissue injury? How do we treat a mallet finger injury? As we discussed already, only a small proportion of mallet finger injuries ever need surgery. Almost all mallet finger injuries will heal very well if they are splinted, supported and immobilized in a position that allows the tendon and bone to heal. Every time the DIP joint is allowed to bend, the healing tissues will be re-injured and the healing process needs to start again. The fingertip must therefore be splinted in full extension with a splint like this, keeping the fingertip in full extension until the injury is fully healed. How long should the splint be worn? If there's a fracture on the X-ray, usually within 6 weeks, that fracture is strong enough to allow gentle movement out of the splint. If there's no fracture and you're treating a tendon soft tissue injury, that's a little bit slower to heal than the fracture. And usually 8 weeks of full-time splint use is appropriate before gentle movement and part-time splint use is started.
Thanks for watching this first video in our 2-part series on mallet finger injuries. Make sure you check out part 2, where Ian will take you through splinting options and the recovery process for your mallet finger injury.